So, if you're dealing with hypothyroidism, you've probably seen the names floating around. Synthroid, Armor, levothyroxine, and man, the internet is just full of really passionate arguments for one over the other. In this explainer, we're going to cut right through all that noise and get to the science behind the great thyroid treatment debate.
Let's just dive in. This is the big question, right? It's the one at the heart of the matter for millions of people. You get the diagnosis, and all you want is to feel like yourself again. But the path to getting there can seem, well, surprisingly complicated, with two very different ideas on how to do it.
Okay, so you've basically got two main players in this game. On one side, you have the modern standard of care, levothyroxine. It's a pure, synthetic, lab-made T4 hormone. And on the other side, you have desiccated thyroid extract, or DTE. This stuff comes from pig glands and has both T4 and T3 hormones. It's often called the natural choice, but as you're about to see, that word can be a little misleading.
First, let's break down why pretty much every major medical organization, we're talking the American Thyroid Association, the Endocrine Society, all the big ones, recommends starting with levothyroxine. The whole reason is about working with your body's own incredibly smart system.
See, levothyroxine isn't some super complex drug. It's simply a pure, stable version of the T4 hormone. Now, think of T4 as the raw material. It's not the final active stuff. Instead, your body takes this T4 and brilliantly converts it into the active hormone it needs, exactly where and when it needs it.
And this is the really cool part. This approach isn't about hijacking your body's controls. It's about simply refilling the tank. You give your body this nice, stable supply of T4, and your own tissues, your brain, your liver, your muscles, they do all the heavy lifting. They pull from that supply and make the active T3 hormone at the precise rate they need. It's a totally personalized, on-demand system. It's beautiful.
And that brings us to the magic number. This number is the key to this whole discussion. A healthy human thyroid makes about 14 parts of T4 for every 1 part of T3. Seriously, burn this ratio into your brain. 14:1. That's the natural blueprint we're trying to replicate.
So, if the standard way is so logical and elegant, why is there even a debate? Why do so many people swear that DTE, the natural option, is the only thing that works for them?
Well, DTE was actually the original treatment used for decades before we could even make synthetic T4. It's made from the dried up thyroid glands of pigs, and its appeal is pretty simple. It has both T4 and the active T3 hormone, which some people feel is that missing piece of their wellness puzzle.
And look, you can't just ignore this, right? There are a ton of patients who will tell you they feel dramatically better on DTE. They talk about improvements in everything from brain fog to their energy levels. It's their personal experience that really drives the demand for this stuff. But there's a big clinical catch.
And this is where that positive patient experience starts to run into the hard realities of human biology. And it all comes back to that ratio we just talked about.
All right, if you take away one thing from this whole section, let it be this. DTE is natural for a pig, and a pig's body works very differently from a human's body. This isn't some tiny detail, it's the whole reason this debate even exists.
And wow, this chart just lays it all out, doesn't it? Remember our human ratio, that perfect 14:1? Well, DTE comes in at a ratio of about 4:1. That means with every single dose, you are getting a massive, totally unnatural blast of that active T3 hormone, way more than your body would ever make at one time.
So this flood of T3, it hits your system like a tidal wave. For a few hours after you take your pill, your body is effectively in a state of hyperthyroidism, of being over-medicated. And that can cause very real symptoms like a racing heart, anxiety, feeling shaky, not being able to sleep. It's a total hormonal roller coaster every single day.
And you might think, okay, so I feel a little jittery for a few hours, big deal. Well, it is a big deal. Over months and years, putting your body through that cycle over and over again carries some serious, well-documented health risks.
The organ that really takes the brunt of this T3 spike is your heart. Forcing it to deal with these daily periods of overstimulation is like redlining a car engine again and again every day. Over the long term, that significantly raises the risk of atrial fibrillation, a really serious heart arrhythmia that can lead to a stroke.
And it's not just your heart. Your bones are in the line of fire too. Too much thyroid hormone speeds up bone loss, and over time that can lead to weaker bones, lower bone density, and a much higher risk of fractures. That's a condition we all know as osteoporosis. And then there are just the practical issues, beyond the big health risks. For one, DTE isn't recommended during pregnancy because the developing baby's brain needs to do its own T4 to T3 conversion. Plus, because DTE is a biologic, it comes from an animal, it has a history of recalls in batches with inconsistent hormone levels, which makes getting a stable, precise dose a real challenge.
So where does that leave the people who are on the standard levothyroxine and still feel just off? Are they just out of luck? No, not at all. A good doctor doesn't just stop when they see a normal lab result on a piece of paper.
This quote is so important because it gets to the heart of what good medicine should be. The goal isn't just to make a number on a lab report look good. The real goal is to get you feeling well, to get your body's systems back in harmony at a deep, cellular level. It's about getting rid of the fatigue and the brain fog. It's about how you actually feel.
So, a good doctor isn't just going to shrug and immediately jump to DTE. No way. They're going to have a plan. First, they make absolutely sure that your T4 dose is truly optimized. Second, they'll play detective and look for other things that can feel just like hypothyroidism, like vitamin deficiencies or sleep apnea. And only then, in some really specific cases, might they consider adding a teeny, tiny, separately controlled dose of synthetic T3. This way, they control the ratio perfectly, avoiding that unpredictable spike you get with DTE.
And that really is the key takeaway here. It's this distinction. While DTE comes from a quote-unquote natural source, the standard T4-only therapy is more physiologic. That means it works in better harmony with the actual natural processes of the human body. It trusts your body to be in the driver's seat.
At the end of the day, having this knowledge is all about empowering you. It's about being able to have a smarter, more informed conversation with your doctor. Because the goal is a treatment plan that goes way beyond the lab numbers to truly optimize your health and your entire life. So what's the first question you're going to ask?